It's Patrick Hutzel from intensivecarehotline.com with another quick tip for families in intensive care. So today I was talking to a client who had their 28-year-old daughter in ICU about 2 years ago, and we have been asked to do a medical record review. So the reason we have been asked to do a medical record review is a very sad reason. Their 28-year-old daughter at the time died in intensive care. And the story goes as follows. Their loved one was in ICU with a breathing tube after pneumonia. They couldn't get off the breathing tube, and they were told the only option for their loved one is to basically die if they can't come off the ventilator. They have never been told that tracheostomy is an option. To cut a long story short, their daughter was eventually moved into hospice, where she was more or less euthanized. She was given morphine and midazolam, and she eventually died in the hospice. Now, that is euthanasia, and euthanasia, as you would know, is illegal. Now, after having worked in intensive care for 20 years, I can tell you for sure that the intensive care team has not been transparent with the family, because if somebody can't come off the ventilator, especially at such a young age, but even at an older age, the next step is to have a tracheostomy. It really comes back to what I keep saying over and over again. The biggest challenge for families in intensive care is that you don't know what you don't know. The intensive care team can tell you whatever they want if you don't start asking the right questions, if you don't do your research, and if you don't talk to professionals like ourselves here at intensivecarehotline.com, where we can help you step by step, every step along this tough ride that it often is when you have a loved one in intensive care. So imagine they would have come to us 2 years ago. We could have guided them, we could have advocated for their daughter to have a tracheostomy. She would probably be still alive to this day. So it's a very sad story. Don't get into that situation yourself. There's help out there. Check out intensivecarehotline.com, read our case studies, and contact us either on one of the numbers on the top of the website or below this video, or send us an email to support@intensivecarehotline.com. Like, comment, and subscribe to my video channel here on YouTube, and I will talk to you in a few days. This is Patrick Hutzel from intensivecarehotline.com, and I'll talk to you in a few